Hey, welcome back to my YouTube channel. So today we will begin with the second part of benign and malignant tumors of oral cavity. So in this video we will first begin with osmf. It is very important. It comes in theory for 15 marks. So remember it very thoroughly. Learn its definition properly. Okay, it is asked in viva and you have to remember all about osmf. It can come either in third year and it can also come in your final year. So before beginning with osmf, what is osmf? It is basically oral submucous fibrosis. What is it? It is oral submucous fibrosis. Basically, it is a chronic condition that progresses further and it is basically found in people of Southeast Asia. It is a chronic progressive condition commonly seen in people of Southeast Asia. Okay, so it is a pre-malignant lesion. Like in my last video I have shown you the difference in the pre-malignant lesion and the pre-malignant conditions. Okay, some other names were given to osmf. We will discuss the other name that were given. It was also called as idiopathic scleroderma of mouth. It was also called as juxta epithelial fibrosis and Asian sideropenic dysphagia. You should remember these other names, as when the question comes for 15 marks you should have a certain amount of length to write, so you can also write about the other names. It gives examiner the view that you know better than others. Okay, so please just remember about these things. Now we will start with its definition. That is the utmost important thing. Okay, first of all, the definition we will study was given by WHO in the year 1978. It was defined as a slowly word is very important. It was defined as a slowly progressive disease in which fibrous bands form in oral mucosa, ultimately leading to severe restriction of movement of mouth, including the tongue. Okay, you have to remember both the definition. First of all, we are studying the definition given by WHO. It is a slowly progressive disease in which what are the basic conditions that are found in osmf. You will given a condition like in the case of buccal mucosa of the patient, there are basically the fibrous bands. So in the definition it is also mentioned, it is a slowly progressive disease in which fibrous bands are formed in oral mucosa, ultimately leading to severe restriction of the movement of mouth, including the tongue. You have to remember this definition also, but most important, which the examiner asks you in the viva, is the definition given by Pinberg. Pinberg gave this definition in the year 1966. He defined osmf as an insidious chronic disease affecting any part of oral cavity and sometimes the pharynx, although occasionally preceded by and or associated with vesicle formation. First of all, we will study about this. It is an insidious chronic disease affecting any part of oral cavity, sometimes the pharynx, although occasionally preceded by or associated with vesicle formation. Okay. Then in the continuation to this, it is always associated with juxtaepithelial hyalinization. Basically, in the definition, you should not write hyalinization. It is a juxtaepithelial inflammatory reaction followed by fibroelastic change of lamina propria with epithelial atrophy leading to stiffness, of oral mucosa and causing trismus and inability to eat. So basically this definition was given by Pinberg, which all of you have to remember by heart as it is asked in the viva. It is defined as an insidious chronic disease which can affect any other part of oral cavity and sometimes the pharynx, although occasionally preceded by and or associated with vesicle formation. It is also always associated with juxtaepithelial inflammatory reaction followed by a fibroelastic chain of the lamina propria, which can lead to the epithelial atrophy, further the stiffness, leading to trismus and the inability to eat. You have to remember this definition by heart. Okay, all of you should remember it. It is asked basically in the viva because it is a very tricky one. So examiner always try to mimic how you remember this. Okay, it is very gimmicky definition, so you have to remember it by heart. Okay, then we will we have learned. First of all, the introduction part. What are the other names for which osmf is associated with? Then we have studied about the definition. Next we will study what is the etiology of it. Etiology of it can either be multifactorial. It can either be iron or nutritional deficiency. It can either be chronic candidiasis. It can either be tobacco, lime, or it can either be betel quid. it can either be due to the herpes HPV virus, okay, or it can either be due to the normal immune changes in the body. So basically this is the etiology of it, okay. Then what are the substances involved? Like we have here mentioned the betel quid. Betel quid, what things are involved in the case of betel quid? We will study. Betel quid basically involves erica nut, catechu, slake lime, betel leaf, and flavoring agents. You have to remember this. It is very important to write this, okay, which from which you will get bonus marks. Betel quid basically involves erica nut, catechu, slake lime, betel leaf, along with that of flavoring agents, okay. Then from this we will study the etiopathogenesis. Pathogenesis, okay. First of all, there is choline, then it combines with ricardine. Both of them when combined, they lead to the formation and stimulation of fibroblast along with collagen synthesis. This further lead to increase in collagen production. It is the main component. When it get hydrolyzed, it leads to the formation of ricardine, and further when they combine, they lead to the formation of collagen, further increasing their synthesis. Another we have mentioned in the betel quid composition, there is something called catechu. That is basically tannins. They cause cross linking of collagen, okay, further leading to collagen degradation is decreased. In the both of above cases mentioned, collagen production is increased and collagen degradation is decreased, which further means that there will be the increase in fibrosis, as the name suggests, OSMF, oral submucous fibrosis. So this is the etiopathogenesis, okay. Then we will study the role of, as I have mentioned here, slake lime, है ना? So what is the role of slake lime? In the etiopathogenesis, I have mentioned something about acrolein is the main component, which get further hydrolyzed to form ricardine. Slake lime lead to the conversion of ricoline to ricardine is done with the help of slaked lime, okay. So basically this is the role of slaked lime, okay. And further it causes increase in generation of ROS, that is the free radicals. So basically this involves the etiology. From the etiology we have studied the etiopathogenesis and the role of slake lime. You have to remember all of this very well, okay. Then I have made you study about the etiology here also, but what are the other contributing factors that can lead to OSMF? It can either be tobacco, I have also mentioned it above. It can either be from the smoking, like NNN. From the nicotine it is found. or it can either due to the nutritional deficiencies I have mentioned above, like vitamin B12 and iron deficiency. It can either be candida infection, and it was earlier seen that people who consume chilies in high amount are more prone to osmf, but it was not true. Okay, to some extent it was not true, so you don't have to remember, but you can either mention a point earlier it was considered. Okay, then most important, we will begin with what are the clinical features. Like in the starting I have mentioned the disease is chronic, and in the definition I have mentioned the word insidious. So onset of it is insidious over 2 to 5 years. What are the symptoms associated with OSMF? First of all, when the patient consumes spicy food, there will be burning sensation. There will be blisters found on palate. Ulcerations can also be found when there is OSMF. Okay, there can either be mucositis, inflammation of the mucosa. There can be increase in salivation, mouth become dry, it has a white marble like appearance. Okay, so basically what can be seen on consumption of spicy food, burning sensation is felt, blisters can be found, ulcerations can be seen, inflammation of the mucous membrane can also be found, saliva flow becomes increased, the mouth becomes very dry, and small vesicles can also be found. Okay, along with ulceration there can either be petechiae. Okay, and along with that of this, vesicles can also be found. Sometimes there will be fibrosis is always present, but it can spread downwards, involving that of the pharynx, like in the definition I have mentioned above, and further to that of piriform fossa. Tongue impairment can also be found. Due to atrophy of tongue papillae. Due to atrophy of tongue papillae. Okay, this fibrosis can also involve, apart from the pharynx, it can also involve the nasopharynx, and person can also complain of referred. Apart from the pharynx, it can also involve the nasopharynx, and person's complaints of referred ear to pain. And altered nasal voice. Okay, so these are the clinical features, basically what you have to remember. The features can either be differentiated into early, these are the early features. Okay, most important that you have to remember is on the consumption of spicy food there will be the burning sensation, there will be ulcerations, vesicles, petechiae, increase in saliva flow, inflammation of the mucous membrane, white marble like appearance of the oral mucosa, fibrosis involving the pharynx along with that of the nasopharynx. Apart from this, the patient will complain referred ear to pain, and impairment of the tongue can also be seen due to the atrophy of the papillae of the tongue. Okay, we all know different types of papillae like filiform, fungiform, circumvallate papillae. All of this can also be involved. What are the advanced conditions? Blanching of oral mucosa is seen, along with fibrous bands can be seen in buccal mucosa. Like in the case of early stage, lips and buccal mucosa can be involved, okay, but here the fibrous bands run in vertical direction. Uvula here will show, this is hockey now, it will show like hockey stick deformity. This is the most important, you should have to remember, that is the hockey stick deformity. Apart from this, there will be the fixation, shortening, deviation of uvula and soft palate, okay. Apart, more difficult to swallow. Difficult to swallow will occur as in the case of advanced OSMF, there will be the more amount of fibrous bands formed, further leading to the difficulty in swallowing or deglutition becomes difficult. And further, dense fibrous bands will be formed around the pterygomandibular raphe. These are the advanced condition and these are seen in the early OSMF, okay. Then we will begin with pathology. First of all, there will be fibroelastic transformation of juxta epithelial cells, okay. Vascularity will be lost, muscle degeneration will be seen, there will be atrophy or hyperplasia of the overlying mucosa, and beneath basal membrane there will be collagen deposition. If you know the clinical features, you can yourself write the pathology. Bands will be formed. As the band is formed, blood supply will be lost, collagen deposition will be seen, muscle degeneration will be found, and atrophy of the overlying mucosa is also associated with it, okay. Now, what are the clinical stages of OSMF? Okay, it is stage 1, stage 2 along with stage 3. Stage 1 is normal when the mouth opening is 45 mm or more than this. Stage 2 is reduced mouth opening, that is 20 to 44 mm. And stage 3 is less than 20 mm of mouth opening, that is associated with OSMF, okay. And this is the clinical basis, clinical. And next one we will see clinically and histologically. It was given by Khanna. It was divided into basically 4 groups. Group 1, Group 2, Group 3 and Group 4 was divided into 2. Group A and Group B. Group 1 was called as very early cases. Group 2 were early cases. Group 3 are the moderately advanced cases. Group 4A are the advanced cases. and group 4B are the advanced cases with pre-malignant changes. Okay. Group 1 are the very early cases, Group 2 are the early cases, Group 3 are the moderately advanced cases, Group 4A are the advanced, and Group 4B are advanced along with pre-malignant lesions. You have to remember this. You can increase the length to your 15 marks question, which will give you a benefit. Okay. So rest we will continue with next class. So thank you for watching my video, and please do like, share and subscribe for more. Thank you. If there is any query and you want to give me any suggestion, you can give in the chat box. Thank you.